So fast forward some time, I graduated from college on time, and then we had to start dealing with the liver. My cancer kept recurring in my liver, so I had 4 different liver surgeries over a couple years. I was on different chemotherapies off and on. I was on different targeted drug therapies, and it was really taxing. I was constantly on treatment. I was constantly in and out of the hospital having surgeries. I mean, I would have these open abdominal surgeries every 3 to 6 months for a few years straight. So it was exhausting mentally and physically. And all of these treatments caused other issues like adhesions. So I had scar tissue build up in my abdomen from having so many surgeries that they caused adhesions, which then in turn caused persistent small bowel obstructions. So I'd end up in the ER in the middle of the night, in crippling pain from these small bowel obstructions. I'd have to be in the hospital with NG tubes down my nose and throat. So finally they decided that the only way to get rid of these, hopefully, at least for a period of time, would be to do a lysis of adhesions. So it was another surgery, which ran the risk of producing more scar tissue. But the doctor went in and basically cleaned out as much scar tissue as he could during the surgery, and I haven't, knock on wood, had an issue with adhesions since then. So hopefully I won't. I also had to have another surgery to have an infected tissue expander removed from my abdomen that they put in during one of my liver surgeries in case I would need to have radiation to my liver in the future. They wanted to create a barrier between my liver and my lungs, this expander, but it ended up getting infected, and I had to have that removed. So I had a total of 9 abdominal surgeries over essentially, 8 years, those first 8 years of treatment. So it was ridiculous. It was exhausting. And then 3 years ago, I had my latest recurrence of cancer, and that was in my bladder this time. So they found a tumor. I started peeing blood, and so I immediately went in to see a urologist, and they did a cystoscopy where they stuck a little scope up and looked in inside of my bladder, and they found a tumor there, which was shocking because the bladder is not somewhere that colorectal cancer normally spreads. So I got lucky on that one. But they had to do another surgery where they went in, and luckily they were able to salvage the rest of my bladder. So they just cut out the tumor, sewed it back together, and I went home with a catheter for a couple weeks, but then my bladder healed enough that they were able to remove that. And I was doing okay after that. So after that, we had to figure out how to proceed treatment-wise. And so I had genomic testing done. So they sequenced my entire genome, and they found that I have this mutation that has a particular uptake with aspirin. So the doctors told me, take a normal dose aspirin a day, and you have this has just as good a chance of working as any of the previous chemotherapies that you have already been on. So I've been doing that. That's my maintenance therapy. I still take an aspirin every morning, and so far I haven't had a recurrence. Now, this doesn't mean I'm out of the woods. I still have MRIs and lab work done every 3 months to keep a close eye on things. I've had some lesions show up in my liver over the past year on my MRs, but we can't figure out what they are. They've tried 3 different biopsies to, gather information and figure out if these are mets or if these are just some benign liver lesion that have developed. So we're still trying to figure that out. It's been hard to kind of live in this of the unknown. I go down these rabbit holes of intense research trying to figure out everything that I possibly can about these lesions in my liver and how they're presenting themselves on the scans, etc. But I've finally gotten to a place where I've accepted that I don't have control over it, and we've exhausted every option to figure out what these things are. So right now we're just gonna hold tight and keep monitoring with the MRIs every 3 months. One thing I do wanna say is that I'm not in this, I'm so grateful to have had cancer club. I'm not. I was fine before cancer. I was happy. I was grateful. I was helpful to others. I didn't need cancer to help me realize how tender life is and how important it is to, be a good person and do things that are, outside of just yourself. And so I hate these people that are like, oh, I'm so grateful that I had this experience. No, it's damaged me majorly. I am mentally Like I have so many struggles with my emotional health now that I never had before. And I've worked really hard at things and, seeing a therapist and taking certain medications and doing the different types of psychotherapy, and support groups and all of that, but I'm not the same person I was before cancer, and I never will be, and that's okay, but I definitely didn't need cancer to help me see the world in a new way. If anything, it's made me negative in a lot of ways, lose a lot of my patience. And I also hate the word survivor and fighter. Like, you're a warrior, you can beat this, or you've beat this, you're a survivor. Like, no, I'm not. I'm not out of the woods by any means. I'm surviving, yes, but I didn't choose to fight anything. I wasn't given a choice in this. I'm just doing what I have to do. So that's my story. I guess if I could ask anything of you, it would be to pass the word on how important screening is for people aged 45 and up. Have your colonoscopies, check your booty, pay attention to any symptoms that you may be having. Any changes in your bowel habits, talk to your doctor and force them to listen if you're younger. There is a rise of colorectal cancer in the younger folks, and we're trying to figure out why that is. But for now, just be diligent and paying attention to your own body.